Hi, welcome back to Body Beautiful. I'm Janelle Marie, and with us today we have plastic surgeon Dr. Joseph Mele. We are talking about everything, and in this segment we are going to talk about arm lifts, which I think are pretty, I think they're becoming to be pretty popular because a lot of people don't want the bingo wings.
Well, especially with the weight loss and the new technology that we have to help people lose weight, that's one area where the skin doesn't always recoil the way we want it to.
I know, it's terrible. So. And no matter how much you work out, you just cannot, tighten that area up.
Well, I liked watching, the shows that are showing people how to lose weight and such, and they're showing them how to do exercises to tighten that skin. I wish they actually worked.
I do too. Why
for the folks
is
who
it?
have good elasticity, it'll work as long as they're losing the weight.
That's so sad.
But that doesn't always.
So it's called brachioplasty.
Right.
Just in case somebody is, searching and wants to know more about it. So who's a good candidate for it?
So patients who are good candidates for brachioplasty are folks who usually have lost a lot of weight, or they just have a lot of loose skin on the upper part of the arm.
Okay.
The downside to the procedure is there's an incision that runs from the elbow to the armpit.
Right.
So for someone who has a little bit of loose skin, that's probably not a good trade-off. But for folks who have a lot of loose skin, and some of my weight loss patients, they can't even fit that skin in their sleeve well.
Right.
There's just so much there. For them, the scar is the least of the problems. The problem is they can't get anything to fit, and we can get rid of that extra skin for them and actually tighten it up very, very well.
Okay, so we know you cut along that arm, so what else happens in that procedure?
Essentially, that's what we're doing. Usually I don't do liposuction or anything else along with it, though we can if we need to.
Oh.
Since the most of that fat is in that same area where the skin is, it's just directly removed along with the skin.
So there's arm liposuction and then there's an arm lift. So,
right.
What's the difference? It's just...
The difference is with arm liposuction, we're removing fat.
Okay.
With the lift, we're removing the fat and the skin over it.
Oh, okay.
So it allows me to tighten that skin up also.
All right, so what about after a person has an arm lift? Can they go sleeveless? A lot of women are worried about that. I want to wear my sleeveless shirts in the summer.
Sure. It depends. There's obviously going to be a scar there. We try to hide it along the inside of the arm. So usually it's in a fairly discreet location, but it depends on the scar. And, 1% of the time we'll get a scar that we just don't like. It's either white or red. And a lot of the times, though, we'll get a nicer scar that's thinner, and with time it fades.
Let's take a look at a picture talking about scars. Let's take a look there. Oh, that's not bad. That looks good.
So this is someone with a lot of extra skin.
Yeah.
So you can see the shape of their arm and then the skin hanging off it beforehand. And afterwards, we just get rid of that extra skin. So she does have a scar running from the elbow down to the armpit, and it runs that whole length on the inside of the arm and the lower part of the arm.
Can't really see that.
Well, in that position, it's at the most inferior part.
Let's take a look at this one.
Same idea here.
Oh, that's fantastic.
Same idea. Extra skin, too much, especially towards the armpit, but it extends almost all the way to the elbow.
What about skin elasticity? Is that hereditary or?
It is to some extent, yes. But when people have gained a lot of weight, it gets to the point where it overstretches those fibers. They kind of uncoil and can't spring back.
So sad.
So here, a lot of extra skin. You can see just that sort of draping and wrinkling of the skin that's central. But again, the upper part of the arm looks fine.
Yeah, I know.
And what we're doing is just making the lower and the upper part match.
And that actually looks really good because I cannot see the scar really, and it has that nice shape at the bottom too, which I like.
Yeah, and when I see someone like this where the skin does kind of taper back up towards the armpit, towards the axilla, that's a good sign because it usually means we can limit that scar and not have to go too far into the axilla. When it comes down, sometimes it is like a bat wing. It just connects to the side down lower. That's much more challenging. Well, it can still be fixed. That
is the worst part of the body to try to work out and get tight. I hate that.
Well, it's also hard for me because unlike a tummy tuck, we don't bend over backwards with a tummy tuck so that skin stays tight. With the arm, we have to reach up. So there needs to be some extra skin there in order to keep our range of motion.
But that looks really good.
Thanks.
And a lot of women like that they can do that because now they can go and wear their shirts in the summer and all that good stuff.
We just don't have any alternative.
Love that.
Someday when we have a skin shrinking ray.
All right. Thank you. We are out of time. Thank you so much, Dr. Joseph Mele. We love you. For more info, call the doctor 925-943-6353, drmele.com, sanfranciscobreast.com. I'm Janelle Marie. Thanks for joining us today on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.